Good afternoon to everyone joining us on the East Coast today. Good morning to my fellow West Coast guests, and welcome for those who are able to join us from around the world. Now, if this were a diplomatic event in Africa, we'd say all protocols are observed. In our virtual Zoom world, we can add all time zones are welcomed. Thanks for joining what promises to be a lively discussion today on the transformative impact of 15 years of partnership between African nations and the US President's Malaria Initiative. My name is Martin Edlund, and I'm the CEO of Malaria No More. Our mission is to achieve a world where no one dies from a mosquito bite, and that wouldn't be possible without the partners featured here today. I'd like to thank our co-hosts and longstanding partner, the African Leaders Malaria Alliance, or ALMA, for co-organizing this event. We have a great program for you today, including remarks from Joy Pumafi, Executive Director of ALMA, Dr. Ken Staley, the US Global Malaria Coordinator, who oversees the President's Malaria Initiative, and a roundtable discussion featuring 4 prominent African diplomats, including the ambassadors to the US from Kenya, Rwanda, and Zambia, and the Deputy Chief of Mission from Senegal. That discussion will be moderated by journalist Dylan Matthews of Vox. Before we get started, I want to say a few brief words about why we're here today and what's at stake. In 2005, President George W. Bush launched the US President's Malaria Initiative, or PMI, with the visionary goal to reduce deaths from malaria by 50% in 15 African nations. 15 years later, thanks to sustained bipartisan support and US investment, the global malaria fight has emerged as one of the greatest public health success stories of our time. Thanks to the efforts of many on today's call, both on screen and those watching, more than 7 million lives have been saved, more than 1 billion malaria cases averted, and an estimated $2 trillion has been added to the economies of malaria-affected countries. Give yourselves a virtual round of applause. Despite this progress, a child still dies every 2 minutes from a completely preventable and treatable disease, from a mosquito bite. And more than 200 million people still get malaria every year. That's unacceptable, and our work is far from done. The year after PMI was launched, President and Mrs. Bush hosted world leaders at the White House Summit on Malaria. At that historic event, President Bush said, quote, "The goal of defeating malaria is a challenging goal, yet it can be done. It's not going to require a miracle. It just requires a smart, sustained, and focused effort." It reminds me of an often used African proverb that everyone will know here today. If you want to go fast, go alone. If you want to go far, go together. But that's particularly apt when you're talking about a mission like ending malaria. By many accounts, malaria is the world's oldest, deadliest disease. It's killed more people than any other disease on the planet. Yet we're talking about eradicating this 20 million-year-old disease within a generation in the next 20 to 30 years. We've made rapid progress, but this is a marathon, not a sprint. And the key to our success is the enduring partnership between the US and African countries that we celebrate here today. A decade ago, I had the chance to live and work in Senegal on malaria. And Senegal became a PMI country in 2007. 2 days a week, we would go into and work from the offices of Senegal's National Malaria Control Program, or PNLP. And without fail, whenever we arrived, the PMI team was already there. Comprised of USAID and CDC staff, they weren't working in fancy offices at the embassy. They were working on folding chairs and tables, crammed into corners, because that's where their work could do the most good. They sat side by side, shoulder to shoulder with their Senegalese colleagues, analyzing data, doing micro plans for bed net distributions in faraway villages, and co-creating solutions that have saved millions of lives. As PMI has grown, that spirit of partnership has scaled with it. What began as a $30 million investment in 3 African countries has emerged as a transformative model of effective foreign assistance and genuine partnership. Today, PMI and its partner countries protect more than 570 million people living in 27 of the world's highest malaria-burdened countries in sub-Saharan Africa and Southeast Asia. Today, the partnership between PMI and African countries can be measured in healthy pregnancies, increased school attendance, strengthened health systems, and growing GDP. Now, I would argue that PMI's work is more vital now than it's ever been. The capacities and innovations being created to end malaria are the very same ones you need to combat COVID and future pandemics. The ability to find and fight fevers, equipping frontline health workers, developing real-time data and surveillance systems at the village level. When COVID-19 emerged this spring, the WHO predicted that deaths from malaria in Africa could double, undoing 15 years of progress. But then PMI and its African counterparts sprang into action. They got PPE to health workers to ensure they could continue to test and treat patients on the front lines. They helped reorganize net distribution campaigns in more than 30 countries. And as a result, 95% of net campaigns are on track, and more than 200 million long-lasting insecticide-treated nets will have been delivered by the end of this year. This not only keeps malaria progress on track, but it also takes fevers out of the healthcare system, freeing up vital capacity so COVID-positive patients can access the hospital beds and the treatments they need. At the center of the USAID logo is a handshake, symbolizing the friendship between the US and host countries. Maybe today in this COVID era, it would be more like a socially distanced elbow bump, but the message is the same. And there's no better example of that partnership than the work of PMI in Africa. With that, I'd like to turn it over to my co-host and friend, Joy Pumafi of ALMA, and then to a short video highlighting the significant impact of PMI. Joy is the executive director of the African Leaders Malaria Alliance, an alliance of 49 African heads of state and government working to eliminate malaria on the continent by 2030. Malaria No More and ALMA have been attached at the hip since the earliest days, collaborating and advocating around the unique partnership between the US and African countries on malaria. Joy's a Botswana national who brings a wealth of knowledge and expertise to the malaria fight. She previously served in the Botswana Parliament in several capacities, including in the Ministry of Health, as the Assistant Director General for Family and Community Health at the WHO, and as Vice President for Human Development at the World Bank. Thank you, Joy.
Good day. Your Excellencies, Africa's ambassadors to the US, other ambassadors who have joined us here today, the Honorable Oumar Theo, Deputy Chief of Mission to the US from the Republic of Senegal, Dr. Ken Staley, US Global Malaria Coordinator at the US President's Malaria Initiative, Martin Edlund, Chief Executive Officer, Malaria No More, distinguished guests, ladies and gentlemen. It is with great pleasure that I welcome you to this high-level event to celebrate and recognize 15 years of the US President's Malaria Initiative's laudable partnership, working with our governments in Africa to defeat malaria, one of the deadliest diseases of poverty. In the 15 years of PMI's partnership with African countries, we have seen malaria incidents reduced significantly and malaria deaths more than halved. The US government has been key to this success and remains the largest funder of our fight against malaria. The progress is evident in our communities and families. Increasingly, in more African countries, malaria is no longer the #1 killer of children under the age of 5. We see more empty hospital beds that would have otherwise been occupied by precious little severe malaria patients who instead are now playing, learning, and flourishing. I heartily celebrate this critical partnership between PMI and African Union ALMA member states in the fight against malaria. The global effort to end malaria, which PMI is a major champion and actor of, has ensured that the predictions made by WHO at the start of the 2020 global COVID-19 pandemic, that is a doubling in malaria deaths, has been largely averted. With countries rapidly modifying the guidelines and distributing nets door to door, Africa remains on track to distribute 200 million nets in 2020. Indoor residual spraying has proceeded as planned, and countries have been innovative in supporting one another and working closely with partners to avoid essential commodity stockouts. Seasonal malaria chemo prevention campaigns in the Sahel will reach 20 million children, more than ever before. PMI has had a big hand in the supply and delivery of these commodities and interventions, and we offer our sincere gratitude. However, these gains are fragile if we don't jointly and collectively sustain them. COVID-19 has caught us off guard. With lockdowns taking place, the interruption of supply chains of commodities which are produced outside the continent has led to increased stockouts. At the same time, COVID-19 has hit our economies hard, and this will negatively impact health budgets moving forward. In this regard, we need to sustain both global and domestic resources, including tapping more private sector engagement to ensure that we do not lose the gains that we have so far made in this wonderful fight against malaria. African countries are committed to the fight against malaria. And with concerted efforts from partners such as PMI, we can end malaria in our lifetime.
It's now my pleasure to introduce U.S. Global Malaria Coordinator, Dr. Ken Staley. Dr. Staley was appointed in April 2018 to lead the U.S. President's Malaria Initiative, and most recently, he also served as the Executive Director of USAID's COVID-19 Task Force. To end this ancient disease, we need to harness the newest tools and technologies, and under Ken's leadership, PMI has capitalized on rapid advances in analytics and advanced our use of data for better management and greater impact. It's a thrill to have someone of Dr. Staley's vision and dynamism at the helm of such an important US program. Thanks again for joining us here today, and Ken, over to you.
Martin, thank you very much. And thanks more broadly to our hosts, Malaria No More and Alma. It's an honor to be on this stage with all of you ambassadors and to talk about our shared mission today. You know, as both Joy and Martin alluded to, 15 years ago, there were 3 countries and $30 million committed. And 15 years later, we're in 27 countries with a budget of almost 1 billion people with incredible impact to show for it. The facts are pretty astounding, really. A reduction by 27% in cases, 60% reduction in deaths, all while the population across the African continent has grown by an average of 30% in each country, which means that we are being more efficient with every year passing, with every dollar that we have. Now, those statistics are interesting, but what it really means is exactly what Joy said. You know, 15 years ago, when you walked into a children's ward, you saw a lot of kids with severe malaria. Today, you see very few. Our progress, our partnership over the last 15 years has allowed us to say that malaria eradication can occur within our generation, which means that within our generation, we can walk into a hospital ward and see no children with malaria. And that is truly remarkable. Now, how have we done it? From a PMI perspective, it starts with the bipartisan support that we've achieved from our partners in Congress. Champions on both sides of the aisle for the last 15 years have gone to the mat for us to make sure that we have the funding and the support to make sure that PMI can make a difference. It's also about tools, whether it's new medicines, new insecticide-treated nets, or rapid diagnostic tests. These tools have helped in our fight. It's also the systems we've built, the supply chains, and increasingly the data systems that we're using. Ultimately, our conversation today is about the foundation of what occurs in each country. It's the partnership that we have among the United States and our in-country partners. Ultimately, that makes us greater than the sum of our parts. Now, there are challenges. Drug resistance has become more common. Insecticide resistance has become more common. And COVID-19, as Joy alluded to, has disrupted supply chains and made it very challenging for us to continue our mission to eradicate malaria. It's also increased costs. Costs have increased by almost 25% in some cases for the same services that we were providing last year. But our response during COVID gives me a lot of hope. Our ability as a global community to come together to revise treatment guidelines, as Joy noted, to go door to door distributing bed nets to make sure that our supply chains remained intact. Those all make me confident that our community can continue to rise to the challenge and continue to make progress against this deadly disease. As Martin said, this is about lives saved, but it also impacts society much more dramatically across economies, across education, and ultimately across the world. I'm proud to be on the stage with all of you today and to join you in the fight against malaria. Thank you. Martin, back to you.
Thanks so much, Ken. Thanks also for illustrating the handshake logo for USAID behind you. Now I'd like to introduce Dylan Matthews, the moderator for our distinguished panel, the main event in our program today. Dylan Matthews is a senior correspondent at Vox, which he joined at launch in 2014. He previously worked as a staff reporter at the Washington Post, where he focused on the Federal Reserve, the federal budget, and tax policy. Take it away, Dylan.
Thanks so much, Martin. It's a real honor to be here. It's very humbling to be with people who've been working for so long on one of the great success stories of public health in the short time I've been able to cover it. You know, there are people in the public health world who've described PMI as the best foreign aid program you've never heard of. And hopefully events like this and coverage from people like me can help change that. But it's a really remarkable story. We've heard a lot about it in the last few minutes, but 7 million lives saved, over 1 billion cases averted, and a really tailored and unique approach for each country that the initiative works with. And I'm really honored that we're going to be able to speak with representatives of 4 countries that have taken slightly different tacks with PMI, each tailored to their country's challenges and able to use the resources that PMI brings most effectively. Senegal, for example, has invested heavily in early diagnostic testing. Rwanda has focused a lot on community health workers and improving case management. Kenya has a particular focus on child and maternal health with bed nets. And Zambia is in the enviable and laudatory position to be within reach of eliminating the disease entirely. So to learn more about each of those approaches, I'm really, really honored and humbled to be joined by an incredible panel here. First up, we have His Excellency Ambassador Lazarus Amayo, who's the ambassador of the Republic of Kenya to the United States. Ambassador Amayo is an experienced diplomat who previously was ambassador to the United Nations and the United Kingdom, has played many key roles in the Kenyan Foreign Ministry and served as a member of parliament. We have our second Lazarus, His Excellency Lazarus Kambabwe, who is the ambassador of the Republic of Zambia to the United States. Ambassador Kambabwe also previously did a stint at the United Nations, has served as ambassador to Ethiopia and the African Union, and has a long track record of representing Zambia and working in the Zambian Foreign Ministry. Her Excellency Matilda Mukantabana, who's the ambassador of the Republic of Rwanda to the United States, is also with us. I was chuffed to learn that the ambassador was a tenured history professor before her current service for the Republic. My wife is also a historian, and so the discipline has a special place in my heart. But she has been a very active member of many genocide remembrance communities and worked deeply in scholarship on the legacy of the genocide in Rwanda and the rebuilding, the remarkable rebuilding that has happened there. And finally, we have the Honorable Mr. Omar Tio, who is the Deputy Chief of Mission of the Republic of Senegal to the United States. He has served in the mission to the United Nations, the Foreign Affairs Ministry, and holds a master's degree in business law. So it's an incredible panel, and it's almost hard to know where to get started, but Ambassador Mukantabana, I wanted to ask you about the record for malaria in Rwanda, particularly a sort of a snag that the country hit a few years ago. You saw sort of amazing progress from 2005 to 2012. And then in 2012, you started to see an increase in malaria cases. What's really interesting to me about that is that despite that increase, the focus on community health workers seemed to mitigate the mortality and severe malaria increases. How were you able to achieve that, and how were you able to reverse that increase and continue progress toward eradication?
Thank you so much. And let me start by thanking the presenters who gave a very comprehensive view on malaria, the ones who came before me. And also greet everyone who is on the panel, all excellencies, my colleagues, and ladies and gentlemen. It's indeed a pleasure to be here and to exchange on this very important subject. I deeply appreciate this opportunity to show the impact of a partnership between my country and PMI. As you said very well, from 2005 to 2012, progress was made, about 84% reduction in malaria incidence, and also 74% reduction in mortality. Just to let you know, in 2005, malaria was the leading cause of death in children under 5. And just 7 years later, it has been reduced to 4th leading cause. However, as you mentioned also, between 2012 to 2016, Rwanda saw a very troubling and massive increase in cases. And I'm not going to go in all the cases. There are many theories about that. But in response and with the critical assistance of PMI and the Global Fund, in 2016, Rwanda put in place an effective malaria contingency plan, which has resulted in a 40% reduction of severe malaria cases and a 43% reduction in malaria-related death, especially between 2015 and 2018. So, furthermore, if I might add, this malaria control and prevention efforts have been a significant contributor to the 67% reduction in under 5 mortality seen in Rwanda. The greatest decline in all causes, under 5 child mortality seen within, also relative to other countries as well. So this is a remarkable progress on key human development indicator, and it has transformed our lives very tremendously. And in a large part, these successes were driven by many things, including what you mentioned, local community health workers who were able to detect the cases early and prevent excess mortality. We worked hard to increase the number of community workers throughout the whole country, and the use of technology, especially SMS, for case detection and reporting of supply chain issues. Rwanda has among the highest rates of malaria spending per person at risk in sub-Saharan Africa, and also among the highest proportion of funding coming from domestic resources. So we invest also heavily in malaria. Reducing the malaria burden is the key to realizing social and economic growth. And this is especially true for vulnerable population, including pregnant women, young children, and adolescent girls. Our long-standing partnership with the PMI and our joint investments in reducing the malaria burden are essential components of our universal health care and health insurance scheme, as we work to ensure that all Rwandans receive access to quality care. And each case of malaria we prevent means that we can allocate resources to other important health and social needs. It's important to note that PMI and Global Fund also support the procurement of malaria diagnostic tests and anti-malaria drugs used both at a community and healthcare facility in all 30 districts of our country. A strong surveillance system was put in place for treatment efficacy and insecticide resistance monitoring to guide evidence-based interventions across the country. And more importantly, maybe the last point I can put is that Rwanda has been able to distribute new and improved bed nets. These new dually treated bed nets are the second insecticide or a booster, which has been effective of controlling insecticide resistant mosquitoes and has shown strong evidence they have potential to effectively reduce malaria cases and save more lives than the existing single treated bed nets. So thank you very much for your help, but I think we are getting there. And as you said, it's a continuous battle, but also it's an existential threat if we don't address it. Thank you.
Thank you so much, Ambassador. Ambassador Amayo, I wanted to ask you a bit about PMI as it fits into the broader relationship between the United States and Kenya.
Thank you very much, Dean Matthews. Let me, like my colleague, begin by acknowledging, of course, Mr. Martin Edland, the Chief Executive Officer, Malaria No More, my sister, Madam Joy Pumafi, Executive Secretary, African Leaders Malaria Initiative, Dr. Ken Stanley that has just spoken, the distinguished partners in the fight against malaria, and my colleagues, the Excellencies, Ambassador Kapambwe, Ambassador Mukantabana, and my brother Theo, the DCM of Senegal. Ladies and gentlemen, I'm delighted to join this very important conversation on the fight against malaria. This is even more critical for me since President Kenyatta he continues to offer leadership in this front as the current chair of African Leaders Malaria Initiative. Back to your question, let me begin, Dylan, by saying that Kenya and the US enjoy long-standing, multifaceted bilateral relations, which in 2018 at the meeting between President Kenyatta and President Trump, they chose to elevate it from the regular to a partnership. And under that partnership, we had 4 pillars. And because of the significance of health, we have actually created the 5th pillar, which is on health itself. And so we have had, under this strategic dialogue, tremendous achievements, but let me get back to specifically PMI. Kenya is grateful for the US support to the health sector through the Presidential Plan for Emergency AIDS Relief, and more specifically, the Presidential Malaria Initiative, which implements its programs through USAID and CDC. Though it is never in the headlines here in the US, but majority of Kenyans are still at the risk of malaria. Many children and pregnant women are still getting killed by malaria, which is a treatable and preventable disease. Yet the progress we have made together in the fight in protecting more pregnant women, distributing more bed nets, and preventing more deaths of children under the age 5 could have not been achieved without PMI and commitment by the American people and government in partnering with Kenya to prevent and save lives from this deadly disease, malaria. As Dr. Stanley noted, we see these benefits in children who don't miss schools because of malaria morbidity. We also see the same even in workplace, absenteeism, which could have arisen because of morbidity caused by malaria. And so though the partnership, through this partnership with PMI, we've been able to expand the malaria prevention and treatment measures, combat and address main causes of maternal and child death. And we are currently working on development of a 2nd generation of malaria vaccine. Gillian, as you may be aware, this partnership has enabled us also to build the capacity of health workers and researchers. The Kenya Medical Research Institute collaborates with the US Walter Reed Army Institute of Research and undertakes diverse medical research programs, which are mutually beneficial to both countries. And as I mentioned earlier on, President Kenyatta, as the chair of ALMA, has set a bold and ambitious 4-point plan, which details of which we can go into later. But I'm happy to note that Kenya, Ghana, and Senegal are among the countries that have so far gone into malaria vaccine trials, which are promising. And so in a nutshell, I'm saying that this PMI has done a tremendous job. We commend them for it. We look forward to continued collaboration. We know it is a grant. Yes, it is aid. That may not be sustainable. And so our desire is to increase domestic resource mobilization complemented with support for donors like the US and PMI, not only for control, but we're also looking forward to eradication of malaria, just like many other countries. We're happy that Argentina and Algeria were able to get out of the list of malaria-infected countries. They are now malaria-free. We believe that it is possible with sustained support, but the tools may need to change, investment more in research and development, support to the institutions or health facilities. If I may just give 1 minute before I leave the stage for you temporarily, it is important that we have efforts towards prevention of malaria, including vector control. But in addition, we also need, in case people are infected, that they're able to go to medical facilities in which they can get proper diagnostics and tests which are reliable. And when they are infected, they have access to treatment which is effective for malaria, because you realize the challenges also of resistance to malaria medicine and resistance to insecticides, and continue the efforts on capacity building and training of personnel. But as we said, the mosquito malaria does not recognize international boundaries. It therefore calls for regional cooperation and international cooperation to combat malaria. Maybe I stop at this stage, but without forgetting to say how deeply we are grateful for support that the US through PMI, managed by USAID and CDC, has partnered with us in this fight and the journey to control malaria and eliminate it, if possible, in our lifetimes. I thank you.
Thank you so much, Ambassador. And the progress in testing toward a vaccine is immensely promising, and Kenya's been doing amazing work there. Deputy Chief of Mission Omar Tio, I wanted to ask you a bit about Senegal. You've had a remarkable success recently in expanding capacity by using earlier detection, greater testing. That leaves a lot of open hospital beds, which is especially crucial right now when you have the COVID-19 crisis layered on top of the existing malaria crisis that many of your citizens have to live with every day. Tell me a bit about your progress there, what it means, and how it's helped you cope with the pandemic over the last year.
Thank you very much. First of all, I would like, on behalf of His Excellency Ambassador Mansour Khan, thank the organizer of this celebration event. In particular, I would like to thank Mr. Martin Redler, CEO of Malaria No More and the Executive Secretary of African Leader Malaria Alliance, Mr. Joe for having kindly invited the representative of Senegal to share our country's experience in the fight against malaria over the past 50 years. Malaria has also, I would like to thank and to say hi to dear excellencies of Zambia, Rwanda, and Kenya. Thank you for participating in this. I say that malaria has always been one of Senegal's main health problems. 20 years ago, it accounted for a third of national outpatient consultation. Since 2007, with the partnership with PMI, we made a lot of progress. So progress against malaria in Senegal has been really unimaginable. So since 2018, we have decreased child death rate by almost 60% and increased net ownership from about 20 to 85%. So we'd like to say that these massive health gains in the malaria fight have translated to overall health gain. For example, all-cause child mortality in Senegal is down to 55%, of which malaria used to be a key cause. Like you said, at this time of COVID, it's important, to have place to have bed for, this disease, and under the the leadership of the Ministry of Health and Social Action and the National Malaria Control Program, in collaboration with the local communities, the donors, multilateral organizations, religious group, the private sector, Institute of Research and academic, and as a key partners, PMI has been able to achieve significant improvement in the coverage impact of malaria intervention in Senegal. We are very, very proud, because PMI has been a proud partner of Senegal since 2007, helping to decrease child death. And I think that the reality is that we couldn't, achieve all that progress without PMI dynamic partnership. So I would like to thank you, to thank the American government for this tremendous support. Thank you.
Thank you so much. Finally, last but absolutely not least, I wanted to bring in Ambassador Kimpabwe, the ambassador from the Republic of Zambia. Zambia has set an incredibly ambitious but totally necessary goal of eliminating malaria in Zambia quite rapidly. You have a national malaria elimination strategic plan and a pathway to get there with the help of PMI and other partners. I was wondering if you could walk us through that, how that came to be, and where PMI fits into achieving a malaria-free Zambia.
Dylan, thank you very much. May I join in thanking the organizers of this very important webinar. And let me say, all protocols observed. Yes, indeed, Zambia has set itself a target to eliminate malaria. And as my colleague from Kenya said, we continue to receive inspiration from other countries that have made it. And it continues, therefore, to reaffirm, as Argentina and Algeria recently did, to reaffirm that it is possible. Since PMI began investing in Zambia in 2007, the country has seen a nearly 25% decline in mortality due to malaria, and the incidence of malaria declining by 30%. And this goal that we have set, which others are calling Zambitious, to eliminate malaria completely, is a target that, as has been demonstrated repeatedly by a number of countries, is not beyond reach, as long as we continue to partner with each other. We have gained valuable lessons in these partnerships, which lessons have helped us a great deal, even in dealing with the COVID, which we have right now. Now, when it comes to statistics generally, I am one of those who tends to get depressed by most of the statistics, and I don't usually like looking at them, especially as they say that statistics have a tendency to reveal that which is important, but also to conceal that which is crucial. In the case of the various statistics that we have shared on malaria, against the backdrop of challenges that we are facing today, with very few success stories, I'm happy that the statistics on malaria are an exception by and large. Now, we are a part of what is known as the E8, namely the elimination 8, and these are the countries from Southern Africa that share a regional goal of eliminating malaria by 2030. In our case, as in the case of Kenya, Rwanda, Senegal, which we have heard, Zambia too has launched a national malaria elimination strategic plan. And this is the basis upon which we are building this vision to eliminate malaria completely. Now, we have said that our success is going to be and is indeed tied with the success of the neighbors, the cooperation of the neighbors. And that's why we have come up with the E8 concept. And you quoted a statement at the beginning when you were talking about going far and going fast, which is very important. We realize, and as Ambassador Amayo said, the mosquito does not recognize any boundaries, any international boundaries. And it is for this reason that we thought that our success would lie in going together with the countries in the region, hence the designation of E8. The lessons, some of the lessons that we have learned and the success stories that we are able to share today are out of this recognition that together we can go far. The success of our neighbors and ourselves is has made it even more important for us in light of the COVID challenge that I said we have. We still recognize that malaria transmission in Zambia still continues to occur, especially in the northern part of the country. And it is in the northern part of the country where most of our economic activity happens, the mining. This is the area of major industrial activity. And therefore, you can appreciate the impact of malaria on the economy of our country, to the extent that the mostly largely impacted area is the north of the country. In the southern part of the country, the transmission rates have fallen to below 1%. And the rates are quite low in the eastern part of the country as well. And in the east, for us, this is the heart, together with the southern region, of our tourism. And tourism is another important sector in our economic development. And so for us, malaria is more than just a disease. Its impact is immediate on the whole country. And so the success rate that we have had with the help of PMI is something that we dearly, dearly appreciate. And just lastly, I know that there will be follow-up questions which we will answer again. I just wanted to put on record our gratitude as a country to the United States. Not only is it the biggest donor to ALMA, but it is also the biggest donor in our country to our efforts to fight COVID. I thank you.
Thank you so much, Ambassador. We are getting some questions from the audience. We're running up against our time limit a little bit, but I wanted to be sure to ask this one. Sarah Jervian from DevX, which is a wonderful development press outlet, asks, can you please talk in more detail about malaria targets still being on track despite COVID-19 and how that was achieved over the last 7 months? What are the challenges facing malaria programs in coming months as a result of COVID-19? So perhaps we could go back to Ambassador Mukantabana. How has Rwanda been able to keep malaria targets on track in spite of the new pandemic?
Thank you so much. That's a very good question. As many people were affected by the pandemic, but one of the things that the country has done in many different areas, especially in health, any matter of health, is that we prioritize the health issues. So we made sure that whatever money or whatever we're getting, we stay in health area, because obviously we can't do anything without health. So it has been, I'm not going to talk about the COVID, but also the way we prepared also was based upon how we prepared in the past, for instance, against Ebola, but also malaria and the resources we attributed to malaria. We kept into consideration that there are priorities even during this time. And whatever resources we come and we got resources from Rwandans themselves, from donors, from what you were able to give. Just to give you an example, there are even people who, in those areas that were affected by malaria, especially in villages, because they didn't have any means of production, any leverage in terms of even getting the existential needs met. So Rwandans found themselves some answers, including even distributing food. That's one of the things, for instance, Rwanda did. The first thing was to distribute food to older people, to ones who were sick, but also to prevent even more contamination. So we prioritized. So we didn't stop addressing malaria when COVID came, because it was part of the plan to actually keeping the people healthy. And I think, in all fairness, I'm not going to say we are, because we have been trying, but Rwanda did a very good program to contain COVID, but also to try to also contain many diseases that would affect people in situations like this. Thank you.
Got it. Thank you so much, Ambassador. And so I think to wrap up, we have a great question from Rose Gallagher, which I think builds on how the question of how to reach malaria targets while handling COVID. Rose asks, PMI has been a strong partner to their focus countries in helping build the capacity of their overall health systems. How have efforts to combat malaria prepared countries to better address other health challenges? Ambassador Amayo, could you talk a bit about how that's worked in Kenya and what that access capacity has meant for challenges outside malaria?
Thank you. As the WHO recognized and warned that disruptions caused by COVID-19 could lead to doubling of deaths from malaria alone. But the malaria fight is instructive for how we can meet the challenges of COVID-19. For example, the same community health workers who distribute malaria commodities to save lives are vital for us to reach populations affected by COVID-19. But what we need to appreciate is that, yes, when COVID came, much attention was given to COVID prevention and control, much attention and more resources were diverted or utilized for that purpose. But thank God, yes, there was domestic mobilization and support from international donors, for which, as my friend from my namesake from Zambia said, the US continued both in terms of malaria and COVID to be the principal or the main bilateral donor, although there were others, but they were the principal one and has always been on matters of health. What we have always been advocating is that in as much as COVID is that serious, containment of COVID should not be at the expense of other diseases that are in existence. Or we should not concentrate much on COVID and lose the gains we'd already got on other diseases, whether it is TB, whether it is HIV and AIDS, whether it is maternal and child health areas, and even the non-communicable diseases. And so, yes, it's a question of setting priorities right, remaining on focus. Thank God that with the measures taken, the COVID mortality or COVID morbidity in Africa largely has not been to the level where they were predicted, say, 3 months ago. We are not yet out of the woods yet, but it has given us time to be able to look at balancing so that simultaneously we take care of control needed for COVID, but continue with the gains and successes or learn from the failures or support that is still required for malaria. Malaria, as we said, is treatable and preventable. Even the US itself was able to eliminate malaria 70 years ago. The example of Algeria and Argentina is just a recent one. We have confidence that with the global partnership, we can be able to overcome not only controlling malaria, but as I said, looking towards eradication. And so in brief, we are on course to tackle not only COVID, but COVID plus other diseases. Malaria has been killing much more. And as my sister Mukantabana said, there's a progressive reduction in the malaria outbreak, malaria morbidity, malaria deaths. But we are not yet out of the woods, because when we look at percentages, like Lazarus Kapambwe of Zambia was saying, percentages sometimes may not give us what is on the ground. When you have a reduction of, say, 10% is significant, but population has also been growing. So if you take it in terms of population, the absolute numbers sometimes are still a cause for concern, but we are on course. We are on course, and we look forward to further collaboration. We know it will not be forever, and that is why the target of 2030, 2063 is with us, so that we can be able to handle other issues other than controllable and preventable diseases. Thank you.
Thank you so much. And yes, as someone who had the privilege to grow up in an America that had eradicated malaria, I'm looking forward to, in our lifetime, seeing Rwanda, Senegal, Zambia, and Kenya be able to offer that to all children in the future. Thank you all so much. Martin Edlund, the head of Malaria No More, is going to close us out, but thank you to all four of you for your time and your insights and your work in this partnership. It's invaluable.
And Dian, before you call, Edmund, let me say the vaccine trial are for Kenya, Malawi, and Ghana. I forgot not to mention Malawi, but there's progress towards that effect. Thank you very much.
No disrespect to Malawi. Martin?
Thanks so much, Dylan. Great discussion. Thanks to our speakers, distinguished guests, to those who joined from your homes and offices. The examples of Senegal, Kenya, Rwanda, and Zambia in partnership with US President's Malaria Initiative give us all hope, but more importantly, they provide a roadmap for disease elimination efforts and pandemic preparedness. Every year through this partnership, nearly 600,000 lives are saved year in and year out. And over the last 15 years, PMI and African countries have achieved historic gains. But our commitment to this mission of ending malaria will be tested in the wake of COVID. And the next 15 years are going to be decisive. They can put us on a path to a world where we ended humanity's oldest, deadliest disease. So we need to renew our resolve. Let's remember what's at stake. The Economist magazine has said that ending malaria would rank among humanity's greatest achievements. Full stop, one of humanity's greatest achievements. Ending malaria would save an additional 10 million lives. It would prevent 4 billion more cases of malaria and free up an additional $2 trillion for African economies. So our mission is clear. And as this discussion demonstrates, the partnership between African countries and US government is going to be the key to achieving that historic goal. So from all of us at Malaria No More and ALMA, let me thank you again for your support, your leadership, and your partnership as we work toward a world where no one dies from a mosquito bite, where malaria is truly no more. Stay safe, stay healthy. Thanks all very much.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thanks.